it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about hair loss. So hair loss can occur from a variety of different problems, including, for example, stress. So you can have stress-related alopecia. You can also have alopecia due to an autoimmune problem. You can have alopecia that occurs due to a scalp disease. So there are many different causes of alopecia. The most common one, of course, besides nutritional deficiencies that we commonly see, is androgenetic alopecia. And this is the kind of alopecia that happens because of a sensitization of the hair follicles to DHT, which is dihydrotestosterone. That doesn't mean that you necessarily have higher levels of testosterone or DHT in your bloodstream, but those hair follicles in particular parts of your scalp are just more sensitive to that DHT. And when we begin noticing this androgenetic alopecia, which can even start in the early 20s, we recommend that you start immediately, perhaps using minoxidil. If you're a man and a good candidate, you can also use Propecia or finasteride, which helps to block that DHT receptor and then protects the hairs and allows them to keep growing. Of course, once you start Propecia, we recommend that you don't stop, because the minute you stop, it's like your body remembers where you would have been 20 years from now, and it will accelerate to that level very quickly. There are some treatments that we do in the office that can also be used in lieu of Propecia or in combination with that and minoxidil, such as PRP. So there are different ways to apply the PRP or PRF, so that's platelet-rich plasma or platelet-rich fibrin. We're starting to use the fibrin more because it seems to act longer on the hair follicles and seems to give a better result. So we can inject the PRP or PRF throughout the scalp, and it again protects the hair follicles and it allows them to keep growing. We can also use microneedling with the PRF, where we create tiny channels throughout the scalp, and this also helps to distribute that PRP, PRF more evenly throughout the area. Once the hair has gone to a point of not being able to be revivable or return, and you're left with bald patches, which can be quite distressing, then at that point, if you're a good candidate, you might qualify to have a hair transplant, which can really be an amazing procedure and restore confidence and be a lifelong improvement for patients that is so gratifying and can really restore and reboost your confidence in yourself. So as long as you don't have a diffuse pattern of hair loss, and you have a good donor site in the posterior scalp especially, we can take what are now called follicular unit extracts, which are small little 1 millimeter punch biopsies or punch grafts of hair follicles, usually somewhere between 1 to 3 grafts per punch, and then those can be reimplanted in the areas of hair loss, and over several months just help restore that hair, which is amazing. It used to be that we would have to take a strip of hair from the posterior part of the scalp, which would leave a fairly long and significant scar. But now with the follicular unit extracts, those little 1 millimeter punch grafts essentially heal without hardly any scarring that is visible to the naked eye. And you can wear your hair really short if you want to and not be embarrassed by a big scar on the posterior scalp. So that is a big advantage of doing the follicular unit extracts. Also, we have better graft survivability. Those grafts that are removed in this manner versus being dissected from a strip of skin are much healthier and are able to survive and give a much more natural appearance. So that's a little bit about the SmartGraft procedure. It is done strictly under local numbing, so you are actually awake during the procedure. It can be somewhat lengthy, but not as lengthy as the prior procedures used to be because of the way the grafts can be stored and the automation of putting those hair transplants back into the scalp. So a little bit of swelling afterwards, really not much recovery time at all, maybe just a few days, and you're back on your feet immediately after the treatment, and those hairs begin regrowing usually within 3 to 6 months after the procedure. So you can come and learn more about it. We can see if you would be a good candidate for a procedure like that if you're suffering from hair loss. And again, we have so many different other options as well. And we always encourage you, even if you do get a hair transplant, to make sure you're doing something at home to maintain and keep that hair that we've just transplanted for you.